I'm Daniel Moore. I am the course leader and senior lecturer for the chiropractic pathways here at Teesside University, both the foundation year and the direct entry into year one pathway. So chiropractic is a regulated healthcare profession focusing on assessment, diagnosis and treatment of musculoskeletal complaints and their associated impact on health. The chiropractic degree program here is a 4-year integrated master's degree. So year one is very much about you learning normal human anatomy, physiology, and a lot about normality. Year two moves on to talk about abnormality and what can go wrong, so pathophysiology and orthopedic complaints and musculoskeletal pathology. So year one is all about normality, year two is all about abnormality, and in year three we put it all together and you start to look at the whole process about how to become a chiropractor and how to go through the whole process. In year four we predominantly have students in an outpatient clinic where they start to actually practice chiropractic under the direct supervision of qualified and regulated chiropractors here at the university. So placement and clinical experience is a really important part of our degree here at Teesside. In years 1 and 2, we use an external placement model, which is a formal model. You go out for 5 days in semester 1, 5 days in semester 2 to various different clinical environments, including chiropractic clinics, and start to put into practice and observe chiropractors in the profession doing the job in the real world. So that's a really important factor for us, and we do that for the first 2 years. In the third year into the fourth year, you will engage in practice within an outpatient clinic at the university. That will be where you are in charge of care and supervised by a regulated healthcare professional, a chiropractor on site here at the university. So chiropractic students have their own space at the university. We have a chiropractic lab that is dedicated to our course. But being integrated into the Allied Health Professions department, we have access to a whole host of different resources here at the university, both from a sports perspective or a rehabilitation perspective or a clinical perspective. We have technicians here that really support us from a resource and facilities point of view. So if there is anything we need for any particular types of research or training or education, we can tap into the resources that exist within the university and benefit from being embedded within that Allied Health Professions department. So in year one, students will cover a range of topics, anatomy, physiology, and chiropractic skills 1. This is where we start to learn how to take subjective assessment from patients or case history taking. So that's a clinical skill you start really early on in your course at Teesside University. After Christmas, in semester 2, we'll start to cover neuroanatomy, so take our anatomy to another level, start to get hands-on with our with patients, where we start to do assessment skills, hands-on physical assessment skills, and we also cover some clinical imaging, which is really interesting and overlaps a lot of modules together. In year 2, we then start to look, as I mentioned earlier, at abnormality. We start to look at pathophysiology. We start to look at orthopedics of either the upper quadrant or the lower quadrant, and we start to also cover health and well-being. After Christmas, we look at evidence for chiropractic and we start to look at research methods. We start to cover either upper or lower quadrant in first or second semester, and we also cover clinical neurology, where you start to learn when the neurology goes wrong, you start to gain that information throughout your second semester. In year 3, we have a module that runs through all 3 semesters, and this is where we start to look at complex case management. We start to add all of the skill sets that we've gained through year 1 and 2 together into one module, and we start to look at that whole 360 degrees of practice. We also tag on to that some functional management, some pain education, and we start to look at a research project that you'll complete in your 4th year. In 4th year, you will be in clinic for about 2 shifts a week. So 2 of your days of your week will be spent as a chiropractic student in an outpatients clinic on site, while you also complete the research project that you planned in year 3. And we will also have an important module called Leadership and Management in Chiropractic, where we prepare you for leaving university and going out and being of service to your community. So we start to look at how to be a chiropractor, how to set up a chiropractic business, how to look after your tax requirements and negotiate contracts with people, and all of those physical and practical skills that are required to go and be successful once you've graduated from Teesside. We've really tried to forge great relationships with the profession over the last couple of years and feel like we've done that successfully. Our formal placement model wouldn't be possible without the support from lots of local chiropractors engaging in that process. We're thankful to all of those and continue to work really closely with them. We also have great relationships with the Royal College of Chiropractors, Society for Promoting Chiropractic Education, the General Chiropractic Council and the British Chiropractic Association, all of whom have some impact on the course positively throughout all 4 years of the degree programme. As we've developed the course, we've really concentrated on creating a variety of different assessment methods. We have practical assessments, written assessments, portfolio-based assessment, as well as some presentations that we've embedded into the degree. Being a very practical subject, there are a lot of practical assessments to do, but we've tried to create that variety so that people can have an opportunity to excel in lots of different areas throughout the different modules. What I really love about the chiropractic programme is how each year blends into the next, and the overarching feeling is that we're getting better at a skill set, enabling us to go and help more people in the future. Everyone that comes on to any healthcare degree should have patients at the heart of the reason that they're doing anything, and I think that the students, as they're going through our programme, can really resonate with that feeling, and without a doubt, being able to develop a skill set that allows you to go and be of service to your patient base is the best thing about our degree and all our healthcare courses. One of the main things I would look for in applicants, either at interview or when talking to them at open days, is a real desire to be of service to people, a real passion for care and a real understanding of the values and standards required to be a healthcare practitioner. If you're interested in hearing anything more about our course, then please do head to our website or think about coming and attending one of our open days where you can meet either myself or one of the other chiropractic course team lecturers.